Okay, this is a quick video on alignment, and we have our trusted spine skeleton here to help explain what it is that we're doing in Do-It-Yourself PT with the postural exercises and alignment exercises to restore the proper curves to the spine and the proper position to the pelvis. So let's go over what that is and what that means. And here you have the base of the skull. So this is here at the base of the occiput, it's called. So this is your head. And then you have 7 cervical vertebrae. So between my fingers is your cervical vertebrae. And you can see, I hope you can see these bones. This is the front of the body. This is the back. So you see those spinous process bumps that you feel along your spine. And we're back to the side view. The size of the cervical bones and joints, they're pretty small compared to the rest of the spine. And yet these poor 7 little vertebrae have to hold the weight of the head, which remember is anywhere from 15 to 25 pounds. So it's crucial that the neck is in the right position to support that heavy weight. However, you can see here that the neck really, because it's attached to the thoracic spine, which is attached to the lumbar spine, which is attached to the pelvis, here, you can see how the position of the neck is completely dependent on the position of the pelvis and the low back and the upper back. So this is what I mean when I say that your body is like a 3-story building, and you've got your first floor at, well, really it's at your feet if we're being accurate, but in sitting it becomes your pelvis, okay? And then you have, well, let's do this. Feet would be the first floor. Let's consider the pelvis the second floor. Then we have your low back is your 3rd floor. Your mid back, that big thoracic spine, is your 4th floor. Your neck is your 5th floor. So we've got a 5-story building. And this little guy is dependent on everything below for its positioning. And then after the 7 cervical vertebrae, we have T1, thoracic level 1, and there are 12 thoracic vertebrae. So here is T12. So between my fingers is 50% of your spine, 12 levels called your mid-back or thoracic spine. And then after that, we have the L1, L2, 3, 4, 5. We have 5 lumbar vertebrae. So down here is your lumbar vertebrae, which then attaches to the sacrum. Can you see that? Let's make sure. So we have, there's your 5th lumbar vertebrae, and then the sacrum is fused. And so sacral spine, lumbar, thoracic, cervical. Now what I really wanted to show you here is the curve, or what's known as your S-curve for your spine. So here is the back, okay? And I'm gonna turn it to the side, but my finger's at the back side, back here of your neck right now. And notice this inward curve of the cervical spine. That's called a lordosis. And then after the lordosis, that inward curve of the neck, the spine moves out into what's called a kyphosis. So the thoracic spine is a kyphosis, outer curve in ideal alignment. And then we get back to the low back, it turns into I'm blocking your view, an inward curve in the last 5 lumbar vertebrae called the lumbar lordosis. So lordosis, kyphosis, lordosis, I don't know if the terms matter, but we got an inward curve, an outward curve, and an inward curve creating your S-curve, but that does matter, and it matters because that design was brilliant. It creates shock absorption through this huge essential core of your body, your torso, your spine. So the S-curve is designed for shock absorption. You also have these lovely discs that are in between each bone also as shock absorbers. So we got a pretty brilliant design here. And often when we have pain and injury and muscle spasms, you get x-rays taken and it says, oh, you have a flattened spine or you lost your curve. So a lot of cervical spines will say in their x-ray report, loss of cervical lordosis or flattened cervical spine, same for the low back. And people think, well, it's gone. Well, it's not always gone. Often we just have to help restore those tendencies, if nothing else, if not the actual S-curve position. And we can do that through stretching, posture, proper walk, and exercises. So we can bring back your shock absorption. We can bring back alignment in how the joints were designed to work optimally. So if you have arthritis and you have joint pain, we can use positions and exercises to put those joints back where they were intended to be and change the forces and protect the cartilage and surface of those joints. So there's a lot you can still do no matter what your x-ray or MRI says. Now I am going to take this guy off and show you the pelvis. So the front here, these bones, that's the ASIS. So a lot of times in exercises like pelvic tilts, I say, okay, find the bumps in the front of your pelvis. And they're right here. I mean, there's one and there's a right and a left. And so that's what I mean by the ASIS, this bone bump right in the front. And then you have the iliac crest here. So I'm turning to the side. This whole thing is the iliac crest. It's just the top of the pelvis. And then the back bump has a fancy name too, called the posterior superior iliac spine, or PSIS. So we got the front and the back. Now why I'm showing you the front and back is because in ideal alignment, the back bump would be slightly higher, and you can see that, I think. I can't hold. Here we go. Let's try this. Come on, baby. Move this guy back. The back bump should be slightly higher than the front bump. Oops, wait, I'm on the wrong side for you. The back bump should be slightly higher than the front bump. What am I trying to say? Let's pull this guy off again. What I'm trying to say is the pelvis should have a slight anterior pelvic tilt. It's about a 6 degree. Some anatomy books call for 4 to 6, 4 to 8, 6 to 8. Let's settle on about a 6 degree, 5, 6, 7 degree anterior tilt. So a lot of our exercises in do-it-yourself pt.com are designed for restoring that position to the pelvis. And yeah, I'm gonna go for it. Okay, why is that so important? So we talked about this being the second floor with the feet being the first. But if we're, let's call it the first floor for our story here. If this pelvis is posteriorly rotated, see, the pelvis is connected to the sacrum. The sacrum is connected to the lumbar spine. The lumbar spine is connected to the T-spine. Okay, so what am I singing here? I'm singing that if your pelvis rotates back, it doesn't move without taking the sacrum with it. And then the sacrum takes the lumbar spine with it. And all these curves go out of alignment when the pelvis is not positioned ideally. So a lot of people stand in a posterior pelvic tilt. So I'm exaggerating it, but that flattens the lumbar spine and steals you of your low back lordosis. Another thing people do is they lean forward and tuck their butt under. Same thing. It's a posterior, so we're kind of just resting on our ligaments, and it's a posterior tilt of the pelvis. It removes your ideal slightly anterior tilt. And so that song, the hip bone's connected to the thigh bone's connected, that is so important, that song, because what it tells you is they're connected. You can't move one bone without affecting another. And that's how the body is completely interdependent. you don't get to have an issue at your pelvis and it not affect your neck or your shoulder or anything else. So it's important when you do your exercise programs or when you go to physical therapy or you're working with a personal trainer that they have a good understanding of how each bone affects each other and that they have the ideal mechanics really well understood, because it's not enough to treat one area. You have to look at the full body if you're going to make a true lasting correction.